It's Dr. Margot R. Imami of RAMD, and today we're going to be doing a neck lift procedure, minimally invasive with some very innovative technology. It's part of the Embrace platform, but the handpiece we're going to be using is called Accutite. It's a very delicate little device that goes underneath the skin, contracts the skin and melts a little bit of fat and gives a beautiful neckline. And so today I have my lovely patient Sheila. And Sheila, tell me a little bit about why you wanted to have this procedure done.
Well, I have a kind of a weak jaw, and it's always bothered me. So it seems as I'm aging, it's starting to slack. I don't have enough structure to hold it up. And Dr. Margot said there's a way to tighten that and be really easy without doing a surgery. You always think you have to go get cut under the knife, but she has something that's going to help me, and it's going to look so much better, and I'm so excited.
Oh, I'm so excited for you. So what we're going to be doing is, if you see on Sheila, we're just going to make a little entry point right here under the chin, and we're just going to address this little area here. And then we're also going to make a little entry point here and going to be addressing these areas. Now we can also do the lower face and the jowl, and this instrument is so fantastic because we can also address underneath the eyes and above and the nasolabial folds if we wanted to. We could also go off the face and do the little axilla area here near the underarm or the bra line or even the abdomen underneath this arm that when women really complain about kind of laxity here, and even the knees. So it's incredibly versatile, but today we're going to show you this area and the lower face. And so we will meet you in the operating room next.
Thanks.
Here we are in the operating room with Sheila for our Accutite procedure. So Sheila has a little bit of relaxing medicine on board. How are you feeling, Sheila?
So relaxed.
So relaxed. And we did our tumescent technique already. It was completely painless. So now she's really nice and numb. And as you can see, the Accutite device is so petite and delicate. And this little probe is just going to be very delicately placed underneath the skin, and it's going to send energy back and forth, just the tip and this little thermistor. And by putting these two together, just like this, we're going to be able to contract collagen and elastin, melt a little fat, and give a really smooth, minimally invasive lower face and neck lift. And so that's what we're going to be doing here today for Sheila, and we will show you various steps along the way and when she's finished, and then her progress after she's healed a little bit more. And we have just finished our non-invasive or minimally invasive lower face and neck lift with the Accutite handpiece. So how are you doing, Sheila?
Oh, I'm great. It feels great.
I mean, Sheila's all wrapped up here a bit like a little mummy, and the dressing is a lot scarier than the procedure, but we want really great compression here because we worked all in this area all the way down to the neck, and then we did some resurfacing of the face as well, and Sheila was awake through the entire procedure. Did you have any discomfort?
No pain.
So see, you can have this procedure very minimal to no discomfort at all. She's gonna go home, hang out for a couple of days with this little dressing and some ointment. Then she's gonna come back in the office and see me. We're gonna take everything off, and then she can apply makeup. She'll wear the little dressing just then at night for about 12 hours for the next 2 weeks, and that's it. Maybe a little bit of redness, which is really covered well by makeup, almost no bruising at all. You really don't get any swelling from the Accutite. From the Morpheus resurfacing, which we did, she'll have a little bit of swelling, but that'll last for just a few days, and she should be back to work before the week is over.
So excited.
Any
Thank you.
questions?
No, so excited. Thank you.
Yeah, she did a great job. She was a rock star. Thank you, Sheila. Appreciate it. We are 2 days post our Accutite procedure with Sheila. How are you doing, Sheila?
Great. I feel great. Everything's perfect. Yeah.
So we just took the dressing off, and as you can see, she's already gotten some really nice definition of the jawline. We have a little bit of swelling just in the jowls, and we always see that in the jowl area. That's the area that you see the most swelling, and that'll last for a week or two, but it'll be very, very minimal. We did extensive resurfacing with Morpheus over the top, and you can see there's very little redness at all. In fact, you can't really even see that she had any resurfacing done. That's how amazing Morpheus is at really resurfacing with such little downtime. So Sheila's gonna wear the chin strap for 12 hours at night for the next 2 weeks. That's really going to help the skin to contract and heal up and further define that jawline. And then over the next 3 to 6 months, you're going to see amazing improvement. And that's going to continue up to a year. So right now we're just in the acute healing phase, but you can see 2 days after the procedure, even in the acute healing phase, she looks presentable to go out. She doesn't have any bruising at all. And she's going to go out and go afterwards to the bank and run some errands, and tomorrow she's going to go to a party, and she's going to be just fine. So how do you feel about the experience so far, Sheila?
Yeah, painless. Nothing hurt at all. I didn't have any pain at all. And it's so weird. It feels so different because my whole middle neck is missing, thank God. But I can feel that it's gone. It's so weird. And it doesn't look like they did anything except it's gone. So that's incredible. Absolutely no pain. That was just totally bizarre.
I know. That's the great thing about it. So we're going to continue to follow Sheila and let you see her progress as time goes on. And we have Sheila back today following her Embrace procedure with FaceTite. Now it's 1 week after she had it. We did Accutite underneath here for the neck lift, and then we did Morpheus 8 on top to resurface this lower face and neck. So how are you doing, Sheila?
Great. Everything's great.
How are you feeling 1 week after the procedure?
Perfect. There's no feeling. There's no pain. It's great. Everybody says it looks great too.
Well, you do look great. And you can see that Sheila really doesn't have any marks at all. It's a week. You can't see any resurfacing marks at all. Now, it's going to take about 3 to 6 months for things to really tighten up, so she's still very early in the healing process. But did you feel this was difficult to go through it all?
Not at all. There was no pain. I mean, literally no pain. It didn't hurt.
And you're back at work today?
Oh yeah, I've been back since Friday.
Since Friday. Yeah. So how many days did you take off of work? About 5?
Well, I took 2 actual days off from work, and then it was the 4th of July, so I got a bonus day.
Yeah.
That was it.
Yeah, so very little time off. You can see it's a pretty easy procedure, and it's just going to continue to improve, and we'll continue to follow Sheila. Thank you so much.
Thank you. Looks great. Thank you.
Once again, it's Dr. Margot, RN.